And in studio to talk about, the medical school and University Health and Dr. Ghali's comments is State Representative Cedric Glover, what's the deal? You read Dr. Ghali's comments. Here's what I said, reinterpreting Dr. G.E. Ghali, he's the chancellor at the medical school, his comments. And what I said was, from what I see Dr. Ghali saying, if it ain't hanging by a thread, it's not a very thick rope. Is that what you heard him say? And from what you know, paying really close attention, is he right?
No, he's not right. Now, in fact, I think, unfortunately, Dr. Ghali is not following the request or desire of the governor, and that is to try not to continue to politicize the relationship between the hospital and the medical school. How
do Dr. Ghali's comments, which may be interpreted as alarmist, but I didn't take them as political. How is that political?
Well, because he attributes some of the challenges that are being faced right now by the medical school to the partnership with BRF and University Health, which these things are not related. What you have to understand is that the situation involving the fiscal health of the medical school has very little, if anything at all, to do with BRF or University Health. In fact, let's take you back 3 years prior to BRF coming in to manage the hospital, the medical school had a fund balance of over $272 million. By the time you get to October of 2013, that $272 million fund balance has now been depleted by almost $100 million. By the time you get to the end of the first fiscal year, where BRF is actually managing, it's now almost $200 million down. So that's $200 million that the medical school has spent of its own fund balance before BRF and University Health ever shows up on the scene.
You see me chomping at the bit over here, don't you?
I am too.
How could Dr. Ghali, the chancellor of the medical school, how could Dr. Ghali be so wrong?
Well, I think that part of what you have to understand from my perspective is that I think Dr. Ghali, unfortunately, appears to be one of those folks who's still a part of this agenda that's trying to undermine and eventually figure out how you get the BRF folks out of the management of University Health.
So he planned to say these things as part of this Machiavellian?
I have no idea what his motivation is, because especially when he references his fund balance being at $70 million. Well, here's what you got to understand. That fund balance last year was at $38 million.
Pardon me again, but you say you don't know what his motivation is. You just told me what his motivation was.
From what I can tell, that's what it appears to be. Otherwise, it doesn't appear as if he is dealing from a very accurate set of facts. Because again, if you go to the conclusion of the fiscal year 15-16, the fund balance for the LSU Medical Center here in Shreveport is $38 million, down from $272 million 3 years prior to BRF ever coming on the scene and taking over management. A $200 million burn through their fund balance before BRF ever takes over management. They end up with their lowest in recent history fund balance of $38 million at the end of 15-16. As a result of fiscal year 15-16, which concluded, 15-16, at the end of the 2016 fiscal year, on June 30th of last year, that fund balance is now $76 million. He had a 100% increase in the fund balance in the course of a year, based upon the time that they've been with BRF and University Health.
Why is Dr. Ghali saying in his comments to the media this week that the trauma center at the hospital might have to shut down? Is that even under his purview?
He doesn't have the authority to be able to do that. The management of all of the systems and operations and functions of the hospital come under BRF.
Why would he say that, Cedric?
Again, I think attempting, as best I can tell, to deviate from what Governor Edwards has requested, and that is, now that we have worked out all of these other issues, to try and come together, resolve these issues, resolve concerns, work together as a team, get focused on making this an actual, real, strong, viable, functioning advancing academic medical center. I think he's engaging in some political hyperbole in an effort to try and, again, to set BRF up as being the boogeyman in this situation.
Let's draw the line. Hyperbole or untruth?
Well, I don't know Dr. Ghali. Here's what I do know. I do know that Dr. Ghali has this position as a result of the governor and LSU deciding not to conduct a national search. I've never known of a medical school filling a position as important as chancellor without going on a comprehensive national search where you impanel a search committee and all of the appropriate folks that are involved with that. And you go and you give yourself the benefit of having options to ensure that you end up with the very best candidate. So obviously I think that there's some potential agenda in that regard. So he's in that position. He's that person now. And unfortunately, I think he's also one of those folks who's probably very close to the folks at Willis-Knighton.
You said a couple of seconds ago, you said you sort of implied that Dr. Ghali just might have connections to WK.
I don't think there's any doubt that...
Okay, do you know for sure? How do you know? Is that based on anything other... What?
What do you know? What do we know?
That's my understanding. That's the hospital that he works with, works out of, and is a part of, and is affiliated with.
So and is doing this at their directive?
I think that there is, from my perspective, a desire to want to capture the market share that is currently held by University Health. Right now, Shreveport is in a medical monopoly where Willis-Knighton currently has over 77% of this healthcare market. It's why our reimbursement rates are 3 times higher than the rest of the state. It's also why our overall quality is less than the rest of the state as well. I think there's a desire to be able to figure out how you circumvent the antitrust issues that currently prevent that consolidation of additional market share, and that is a part, unfortunately, of what Dr. Ghali is advancing by raising some of these issues in the way that he is.
What is your message to Dr. Ghali today? What should he really be doing?
Step forward and truly partner with BRF, with University Health, and with the research function there, and help us to create and facilitate a real, true, comprehensive, well-coordinated, well-led academic medical center so it can become the economic engine that it needs to be to help to provide the healthcare needs of this market, to educate those folks who want to become doctors and therapists and what have you, and also to engage in the research that helps us to be able to generate the jobs and grow the wealth of this region.
But you know way more about this than me, so correct me if I don't understand this. So in your mind, there was this meeting, or a bunch of WK bigwigs came into Dr. Ghali's office and said, okay, you're going to be our pawn of the day. Here's your talking points. Say these things.
Well, it's been a very long-held agenda to try and continue to figure out how it is that you manage to be able to take this market share and I think bring it under the umbrella. It's part of the reasons why there's an antitrust suit that's in place right now. Thankfully, that is going forward, and we'll hopefully be able to bring this to some conclusion. Here's what Dr. Ghali also should be focused on, and that is, as I've shared with you guys before, LSU in New Orleans, their medical school, $400 million goes to their hospital. $200 million comes to the hospital in Shreveport. 10,000 patients treated for $400 million in New Orleans. 20,000 patients treated for $200 million in Shreveport, twice as many. Here's the really important part. Shreveport takes that $200 million and also generates another $400 million in private pay at University Health. $400 million in New Orleans only gets you around $100 million in additional private pay. What we need to be doing is going to Baton Rouge and fighting for more overall funding, more overall money to come to Shreveport, since we are providing twice as much care for the citizens of Shreveport as they are in New Orleans, with twice as many beds, 200 beds in New Orleans, almost 500 beds being utilized here in Shreveport.
In about 30 seconds. So to use a medical analogy, Dr. Ghali is... He's asking for a cure for which there's no disease?
I think Dr. Ghali is trying to, again, kill University Health in Shreveport to open up the door for somebody else.